Now joining me in the studio to talk more about the medical breakthrough on stem cell research is CCTV's Dean Xiao. Xiao, one of the key words we heard from that surgery is stem cell. What are stem cells? What can stem cell therapy do?
Very good question, Qiu Yuan. Well, stem cells are now often viewed as a cure-it-all medicine and for anything and everything. And people say they can cure every disease, create and grow new organs. There is a lot of hyperbole and fears around stem cells, but what exactly are they? Stem cells are early development cells that have the capacity to develop into various types of body tissues. In actual practice, stem cells are derived from embryos, a practice opposed by those who believe life begins at conception, or they are generated from cells taken from a person. Well, the discovery of stem cells has provided a complete new approach to repairing the human body. It's been proposed that stem cells can provide treatment to patients with nervous system diseases such as Alzheimer's, Parkinson's, spinal cord injury, and stroke. Stem cell therapy can also help beneficial to patients with immune system disease such as diabetes and leukemia, and other diseases such as liver disease and cirrhosis. So a lot of implications actually, Julia.
What about in real clinic settings? How can people, benefit from the research on a day-to-day basis?
Well, Qiu Yuan, actually stem cell therapy in general is actually a not new thing. Doctors have been performing bone marrow stem cell transplants for decades. Besides that, there were quite a few clinical successes in India using them to treat blindness. Corneas can be recreated by patients' own stem cells in a petri dish and transplanted to the patient's eyes, helping them to regain their sight. And more than 6,000 Cuban citizens have reportedly received stem cell therapy since the treatment was first introduced in Cuba 10 years ago. The therapy was promising for patients suffering from severe arterial insufficiency in their lower limbs and help avoid major amputations for 58 to 80% of patients. And Malaysia has been successful in transplanting stem cells to treat war-torn or torn cartilage. And there are also ongoing clinical trials using stem cells to treat patients with stroke and spinal cord injuries in the US and UK. And in 2006, some new breakthroughs, scientists have learned how to stimulate a patient's own cells to behave like embryonic stem cells. It's actually a breakthrough that's really opened a lot of new possibilities.
Thanks a lot, Xiao.